Christopher Friese, and I'm a professor of nursing, health management, and policy at the University of Michigan. And I've been here for about 12 years. And my program of research has been focused on primarily measuring and improving the quality of cancer care delivery. But I've always had a special focus on understanding how work environments of nurses influence the quality of care that is delivered to patients with cancer.
Hi everyone, my name's Annette Rafferty. I'm Professor of Health Policy at King's College London. So like Chris, I've also been working on the nursing workforce and its linkages with patient outcomes over quite a long period of time, and leading the England contribution to international health outcomes studies. So we've been building up an evidence base over the last 20 years, looking at how nurse staffing impacts patient outcomes in Europe.
The work that was cited as part of my election to the National Academy of Medicine talks about our work that has documented the relationship between nursing work environments and patient outcomes, particularly for patients who have had cancer surgery. And at the time, this work was quite novel because up until that point, the primary focus of nursing workforce and nursing health services research has been the articulation of staffing, or the number of nurses, or how they're assigned to patients. And in addition, the actual work environment, as the nurses assess it, is a critical ingredient to safe patient outcomes. So it's not just the number or how they're trained, but really how they're organized and supported by leadership. I think sometimes we reduce this to an issue of numbers, and it's really more than numbers. It's making sure we have the right number of nurses adequately prepared and also adequately supported and organized, so that the care we're trying to deliver is optimal and safe.
Our mission in the first international health outcomes study, which took place in the late 1990s, was really designed to challenge the criticism that this was something that was somehow germane to the United States and wasn't transferable or generalizable to other settings. And one of the findings that came out that was relevant to the National Health Service in England in particular was that actually we had some of the poorest staffing levels in Europe, regardless of what the rhetoric was coming from government, that we had a well-funded National Health Service. We were able to challenge and contradict that assertion. And not only that, but we had amongst the highest burnout levels, and we're comparing these levels with countries which had suffered incredible austerity.
I like to think about this in three ways. One is, what can the individual nurse do? What can the leadership do? And then the third is sort of at the policy and the system level. A couple of key things I think for the individual nurse to think about include making sure that as they schedule themselves, that they consider adequate rest time between shifts, that they choose carefully as to whether they plan to work extra shifts, because cumulative shifts are known to contribute to increased stress, increased burnout, decreased job satisfaction. A second recommendation is to do what they can to optimize their own personal health and wellness, whether that's through fitness activities, through making sure that they're making any chronic healthcare needs attended to, making sure they're routinely evaluated for wellness and health promotion. Making sure that they're in the best place possible is another key factor. And we find over time, nurses focus so much on taking care of patients, they forget about themselves. So make sure that your health and wellness are in good place so that you can take good care of patients. And then I think the final point that I recommend is, practice gratitude and be grateful and identify the things that in your work or in your personal circumstances that give you joy, and be sure to keep those in front and center. Why you became a nurse, why you're committed to taking care of patients or communities that you serve. so that we can keep our goal in mind, knowing that there will be challenging times ahead.
Of course, in the pandemic, which has shone I don't even know, people say a spotlight. I would say it's a kind of searchlight, on the profession. And really, really, really good leadership and really, profound investment in understanding kind of well-being of others, and that it's okay if you have to shield, it's okay if you have to take time out. There has to be a kind of self-compassion and compassion, collective compassion for the profession and for each. I'm talking about across the whole multidisciplinary team. It is just so incredibly tough out there at the moment. But there's certainly a demand for, for counselling, big demand. And I think we're only seeing the beginning of this. There's going to be a kind of tsunami. We know that we're shoring up of mental health problems and challenges. The risk of the whole, not the whole perhaps, but a huge chunk of the workforce either leaving or falling over because of physical, mental exhaustion and burnout is just incredible.
Yeah, so I think from the leadership perspective, this is a really important area for our leaders in healthcare organizations and other settings who employ nurses. The first is measurement. And we have valid and reliable tools to measure nurses' well-being and their work environment. And those are freely available. And I encourage leaders to implement plans to routinely measure and monitor well-being, burnout, job satisfaction, et cetera, because if you don't measure these matters, then you really don't know if you're making progress. And you also can't drill down what the factors may be that are contributing. So number one is measurement. The second is assuring that nurses who are expressing difficulty or challenge have a safe, confidential place to go to raise those concerns outside of the administrative command and control structure, but they can get professional support and counseling as needed, other support as needed, referrals and resources, and making sure that that is valued, that is rewarded. We've done a lot of work in patient safety to speak up about concerns, creating that environment of psychological safety. I think we need to have a similar emphasis from our leaders of speaking up if they personally are not okay. And I think that's the challenge for our current leadership. And then I think the third area is to really look carefully at the way that nurses are staffed and scheduled, and making sure that there's adequate rest time, that we're monitoring extra shifts, that you're encouraging people to take scheduled vacation and rest.
I think, staff nurses need agency and they need the capacity to influence those work environments. We know from the work on magnet hospitals that, and these are hospitals which have got strong track records in being able to recruit and retain nurses and also have better outcomes for patients because they have invested in the work environments. And I think, if they're working in areas where they don't feel that level of empowerment, then it's incredibly difficult. If they can influence their environment and help to shape it, then of course they're going to feel more invested in it. And that happens, then they're going to want to kind of stay and continue to benefit from that investment, as well as gain from it, and as well as contribute to it. But that's probably one of the most important mechanisms, is the sort of shared governance structure. But not everywhere's got that. I mean, that's actually in our system, that is something that's more absent than present. So I think that's why the Magnet Project is as a demonstrator of can-do-ness. Yes, this is not something that's exotic and will never, take root on UK soil or German soil, Swedish soil, etc. It is something that can be planted and grown and flourish.
And I think this is really the untapped area of opportunity, not just in the United States but globally, is to make sure that the evidence base for working conditions that promote safe care and safe, healthy nurses is top of any health policy legislative agenda. And that, in not just in the United States, but across the globe, we see very uneven attention to nurses' working conditions, and we see the tragic results in front of us right now. That when we don't pay attention to these matters from a research perspective, when we don't document the concerns, when we don't test and develop interventions, then we find ourselves in the middle of an emergency where we're putting nurses' lives and well-being at risk. So number one is to get nursing workforce and nursing wellness research at the top of the legislative agenda. The second is to produce valid and reliable data so we can monitor the impact of our efforts and interventions, which goes hand in hand with the first. And then the third is the societal understanding that healthcare work is indeed very complicated and complex and requires a very nuanced way of supporting nurses. It's not just about the accolades in the street, but making sure that nursing work is valued in society, that we create employment structures and opportunities that make nursing work rewarding and valuable, that we make sure that our schools of nursing across the world have the resources they need to train and prepare not only new graduates, but existing nurses, making sure that there are professional development opportunities to continue to build on their skills and give them additional training. So those are a couple of the things that we can do at the societal level, at the policy level, to really make sure that the nursing workforce we have in one given country, but really around the world, is optimally positioned to deliver the best care to patients and communities as possible.
I will say we have to insist and ensure that good things come out of this pandemic. And that will be that we somehow harvest the collective wisdom and collective learning, and we invest in working much more effectively